Otitis externa, also known as swimmer's ear, is actually an infectious process in which there's an inflammation or cellulitis, which is an infection of the cells or inflammation of the cells within the inner ear canal, and also can extend out towards the pinna, which is the actual outer part of the ear, and the tragus as well too. And in certain severe cases, you could actually see this infectious process going into the lymph nodes as well too. It's usually seen or diagnosed between the ages of 5 to 19 years of age, but it can be prevalent in any of the age groups throughout the lifespan. There's usually a 10% incidence of this to occur at any time within the population. Now, when we're going over the different or the disease process or the pathology behind it, we want to consider some anatomical normal variations of the ear. So what is normal when it comes down to it? What protects the ear? So one thing that we're looking at is the external features in itself. Just as we talked about the tragus itself, the tragus can actually protect the ear from having foreign bodies enter the ear. So that's a protective mechanism that we have. We also have the inner ear canal where there's little tiny hair follicles that actually help and catch any type of foreign bodies or debris that can actually potentially come into the ear and cause a means to have bacteria grow in there. Last but not least, we also have cerumen, also known as earwax. And the importance about earwax is twofold. One, earwax actually maintains an acidic environment. So what does that mean? Having an acidic environment, that means that bacteria and fungus are more than likely not able to grow. It will kill off these cells. And another thing too is earwax actually promotes what we call a hydrophobic, meaning water-fearing environment. So it actually helps repel water outside or repels the water coming into the ear canal. So again, preventing or pushing that water out decreases your chance of creating this nice warm medium for bacteria and fungus to grow, which pretty much goes over the pathology or what causes otitis externa. So now the pathology behind it or the pathophys behind it is that what causes this disease process? Well, one, trauma itself. A lot of times we think that earwax is pretty much bad for us or it's a discomfort. So what do? We usually get cotton tip applicators or we actually stick our finger into our ears and we start digging away. Well, the thing is, digging away causes all this trauma that occurs, and having trauma within the ear is another way to express or actually help kind of cultivate or culture any type of infection in itself, and actually that could spread systemically, which means you pretty much kind of open the door for the bacteria to start growing around the area. Another thing too, especially when it comes down to trauma, especially nowadays, I see everybody with earphones and so forth. So again, sticking stuff in your ears, earphones, hearing aids, believe it or not, and also earplugs as well too. Those are sticking things in, and these are foreign objects that can actually cause trauma around the external ear and also within the ear canal in itself that can actually um, start or actually help out with the bacterial or fungal growth. Something that I do want to talk about too is hearing aids. That's more of a fungal thing rather than a bacterial thing. So that's a little interesting fact there. And also swimmers as well too. So again, swimmer's ear is the nickname for it. How does that cause a medium for bacteria? Well, the swimmer, that individual usually is more exposed to the water that has a lot of other chemicals, specifically chlorine. And what it does is that it actually causes more of an erosion within the ear canal in itself. Well, that erosion is going to actually cause that trauma, which will actually provide a medium for the bacteria to grow. And not just that erosion that occurs, but also, if you think about it, it's water, it's nice and warm, it's nice, it's a nice lovely bed for bacteria and all these microbials to actually start growing. So looking at everything between trauma and the heat and the humidity, those are the most important things that will cause, or that's what causes the otitis externa to occur. Now, with that being said, things that we will consider, and I'll talk a little bit more about preventive measures, is this usually targets one, the ages of 5 to 19 years old, because again, a lot of these individuals are engaged in more outdoor water recreational activities. Also, again, they're more likely to or be susceptible to any type of trauma, especially they like sticking stuff in their ears during this time as well too. And just a combination of those factors will lead to a patient actually developing this type of pathological process. Management of otitis externa can be done in multiple ways. So it's a lot of symptom management and also targeting the actual infectious process in itself. So what to anticipate when you come to the provider's office? Well, sometimes we'll do our exam and we want to clean out the ear. And the most important thing about cleaning out the ear is so that we could get into the infection in itself or whatever's are affected and get that good assessment. So again, something that you would consider when you come into the doctors is getting your ears cleaned, and I'll go over that here in a little bit. Another thing too that we want to actually target is the infectious process in itself, so that's why we're giving an antibiotic. And also we want to decrease that inflammation or that irritation, so what do? We give you some steroids with it as well too. A lot of times you'll see more of a combination therapy that's pretty much provided via your eardrops. And last but not least, pain management. Again, depending on how bad this infectious process is, sometimes we might need to give you some kind of pain management or some kind of pain medications just to help alleviate the pain. So when it comes down to cleaning out your ears, you would anticipate a 1-to-1 3% hydrogen peroxide solution to help irrigate or pretty much break down the earwax buildup that's occurring within your ear. Again, this is something that you would do within your doctor's office or within your provider, that we could actually guide our assessment. Our assessment based off of what we can see. So again, that's some kind of medication or some cleaning solution that we could use when it comes down to it. Again, it's usually done at the provider's office. Next, we actually want to target more the mild form, or how bad, or we want to look to see how bad the otitis externa is. So sometimes our first line of medication that we use is Cipro eardrops. So the Cipro HC eardrops are a combination of Cipro and a steroid in itself, and that pretty much targets two or the most common bugs that can potentially grow within otitis externa, which is the staph infection and Pseudomonas as well too. So again, those are what we're targeting. So things that you want to look out for is number one, hypersensitivity to Cipro. So we would get a good medical history on you to make sure that you're not allergic to Cipro before we give you this medication. Again, hypersensitivity to it. You want to make sure, well, one, you'll be contraindicated for it and you're not going to be getting this medication. But if you're not, if it's your first time using it or second time using it, you want to monitor for these types of allergic reactions. So next thing is, how do we give the medication, or how do you use these drops? Well, most important thing is number one, you want to make sure your ear is nice and cleaned out based off of what your provider's recommendations are. And then number two, the dosage for this is you're going to administer it 4 drops 2 times a day for up to 7 days. Again, you're going to administer 4 drops twice a day for up to 7 days. So one thing that you're going to want to monitor is that within a week's time, you should be getting, or you should start seeing your symptoms resolve. Now, if it's about the same or getting worse, this is where you come back to your provider and probably might want to culture the area and see what really is growing around there and go ahead and treat it specifically. But going back to the Cipro HC, instilling the drops, you want to make sure for adults or older children, you want to make sure you're pulling the ear up and back. Now, pulling the ear up and back actually straightens out the ear canal, so you could instill the drops and it could target the specific area that you're going. Now, another thing too that you want to consider is that if they're younger or a younger pediatric population, you want to pull the ear down and back because of the anatomy of it is a little different. Now, when instilling the drops, you want to make sure that the affected side is pointing up, and then that when you're instilling the drops, you want to, as much as you can tolerate, hold the affected side up for about to 20 minutes. Now, by doing so, this will help pretty much absorb the actual medication within the area that you want to get, and that will help maximize the treatment goal. Now, another medication that you could, and that's pretty much Cipro HC there. Another medication that you would anticipate for any type of more, I guess, severe type cases is corticosporin. And how corticosporin works is it's pretty much an earwick. So what happens is you actually use an earwick. You instill about 3 to 5 drops, actually 5 drops within the earwick, and you're going to place it in your ear. You could keep this earwick for up to 24 hours. And what you'd usually do is you want to maintain moistening by adding 3 to 5 drops every 4 to 6 hours to keep that area nice and moist, and that's what's going to cause you to deliver that medication. Again, coming back just a little bit, corticosporin is a combination of antibiotic and a steroid in itself. Again, you want to make sure that you're going to keep the earwick in for about to 20 or for up to 24 hours. And again, you want to continuously instill, or even after that 24-hour, you could pull the earwick out, and then you could keep instilling 3 to 4 drops a day as indicated, or whatever's prescribed for you. You want to, again, same thing as the Cipro HC itself, is you want to monitor for any adverse reactions or hypersensitivity. Now, if the pain is intolerable to where you're going to need some type of medications, the first go-to types of medications are your NSAIDs, specifically ibuprofen, which is given in 400 to 800 milligrams, depending on whatever the 400 to 800 milligrams per dose based off of whatever the provider's recommendation, or you can actually anticipate getting naproxen as well too. Naproxen is about 250 to 500 milligrams per dose. Biggest things about NSAIDs, whether it be ibuprofen or naproxen, is number one, you want to make sure that you are taking these medications not with an empty stomach. Again, you want to reduce your chance of any types of GI bleeding or gastrointestinal bleeding. Also, you want to make sure you're monitoring for any type of hypersensitivity as well too. And biggest thing is things that you should probably look out for is any type of nausea, vomiting, again, any kind of gastrointestinal bleeding, any type of increased bleeding anywhere else as well too. Those are some things that you want to monitor for when taking these types of medication, or when taking any types of NSAIDs in itself. So those are the those are your most common drugs that you can see that are specific. So prevention and health promotion, when it comes down to otitis externa, there are a couple things that we want to consider. So number one is prevent trauma in itself. So again, you don't want to stick anything, or you want to advise, especially individuals, just not to stick anything in their ears. One that we're looking at more are cotton tip applicators. Again, earwax is a good thing to have. It's a protective barrier, as we just discussed. It actually keeps that bacteria out, and it actually protects us from having any type of injuries related to it. So again, if you feel like you're starting to have that earwax build up, or it's starting to bother you, this is where you need to contact your provider and probably consider getting it professionally done. Number two is we want to target the swimmers out there, especially individuals that are engaged in outdoor swimming kind of activities. So biggest thing is, after you're swimming for a prolonged period of time, again, you want to make sure you shake out your ears. You want to dry your ears out. Again, shaking them out just to make sure that you don't have any type of water that's staying stagnant, because again, we talked about it, water and warmth and humidity are all means for bacterial growth. So this is the stuff that bacteria and fungus likes to grow. Again, you might want to consider instilling some preventive medications or ear drops as prescribed, so that you could prevent otitis externa as well too. This is going to be based off of whatever your provider kind of mentions. And again, The biggest thing is when it comes down to it is you can maintain or use earplugs as well too when you're swimming. But again, you want to be careful that you're changing out your earplugs and you're maintaining good hygiene and they're nice and clean. Another thing too when we're talking about earplugs is also headphones as well. I kind of had a little bit of a discussion when it comes down to it. There's a lot within the age group of 5 to 19, but around teenagers especially where those earbuds kind of stay in for a while. So you want to exercise or maintain good hygiene when it comes down to any type of earbuds or even hearing aids as well too for individuals that need that. So again, good hygiene, you want to make sure they're nice and clean and replace them accordingly. So again, those are some preventive measures and also health promotions when it comes down to otitis externa.